We have a crew of 30 medical professionals who are employed full-time. Among them, there are emergency medical specialists, anesthesiologists, and nurses from various different backgrounds, including neonatal care, pediatric care, as well as adult intensive care. Depending on the clinical severity of the patient, we staff our missions to best fit the needs of the patient. The standard crew composition is one doctor and one nurse, and this is our standard. But depending on the clinical severity of the patient or the presence of multiple patients on board our aircraft, we may choose to add a third or even a fourth member to the crew. Certainly, all of our crew members, upon joining Redstar, must undergo a medical crew orientation training, which includes flight physiology and aircraft familiarization. Apart from this training, which is provided in-house, we also obviously train our crew with outsourced training topics such as ACLS, which is the Advanced Cardiac Life Support training, NRP, which is the Neonatal Resuscitation Program, and the PULSE, which is Pediatric Advanced Life Support training. These training programs are outsourced to external providers, and they are repeated on a biannual basis. Apart from this training, we also provide all of our crew members with aviation training topics, which include CRM, which is Crew Resource Management, and Emergency Safety Equipment training. Training does not stop here, and we make sure that our crew are continuously trained during their course of employment at Redstar to ensure that they are kept up to date with the new developments in the industry. All of our aircraft are equipped with the latest intensive care unit medical devices. So we are able to measure invasive blood pressure of our patients. We are able to fly patients that are dependent on the ECMO device. And we are also able to check blood gases of our patients by way of point of care testing devices. And also high flow oxygen treatment. We are also able to provide that on board our aircraft. All of our devices are in line with the current requirements of international guidelines. We are proud to be the only air ambulance provider in Turkey with the URAMI accreditation. So we have an array of the latest in technology medical equipment on board all of our aircraft. All of the aircraft in our fleet are equipped with double stretchers, so we technically always have this capability to transport multiple patients simultaneously. But yes, we obviously determine whether a transport of multiple patients at the same time would be appropriate for the patient's conditions and also the route of the flight. So the primary determinant is really the clinical severity of the patients. And the other factors, yes, they do play a role, but they are usually secondary to the patient's actual conditions that would allow us to safely conduct a multi-patient transport. With the addition of the Challenger 605 aircraft to our fleet, we are now truly a global operator. So we perform missions that are short domestic flights, as well as flights that take plus 20 hours, crossing several continents in one single mission. Some of the most challenging missions that we undertake are evacuation of patients from conflict zones, so countries such as Afghanistan, Iraq, and Yemen. The logistic planning stage of these missions are difficult, but also it's a large clinical challenge for us because the level of infrastructure that are available in these countries are comparatively low to Western standards.